Well, the state's last remaining county-wide mask mandate ended with the expiration of Monroe County's health emergency. Pat Bean reports on why now and what you should still do to combat COVID-19.
The mask required signs on doors and storefronts will be a thing of the past come this weekend. After 2 years of on-again, off-again mandates, you'll no longer be required to mask up when inside schools, businesses, restaurants, anywhere. But that doesn't necessarily signal the end of the pandemic.
I don't know if I'd still call 65,000 cases a day in the U.S. and 50,000 still in the hospital and 10,000 in the ICU and 1,800 deaths per day endemic yet. That's not really endemic, but I think, we very well could be exiting a pandemic phase.
McKean says that, even though the mask requirement is set to end, he's not ready to ditch his mask.
I think I will still mask in certain indoor situations like grocery stores or assembly hall and places like that where there's larger amounts of people and maybe I don't know the vaccination status.
McKean says people continuing to wear masks should use only the high-filtration K95 or KN95 masks rather than the cloth or surgical masks, which have proven to be much less effective. The end of the county's mask mandate coincides with the expiration of the state health emergency. And it comes as COVID numbers in the state have fallen drastically from the last wave in mid-January. Just 6 weeks ago, almost 19,000 new cases were reported daily, about 3,400 Hoosiers were hospitalized, and more than 70 were dying daily from the virus. Today, those numbers are down to about 300 new daily positive cases, fewer than 1,000 Hoosiers are hospitalized, and daily deaths are in the single digits.
So I think there's lots of reasons to be optimistic about begin moving back towards a quote-unquote normal routine.
One thing that may work against the state is the fact that just more than 54% of Hoosiers are fully vaccinated. And with COVID numbers dropping, so too is the number of Hoosiers getting vaccinated. Kranis co-authored a CDC study on the effectiveness of vaccines. He says if you haven't been vaccinated or partially vaccinated, you should still get the shot. He says the best defense is having been vaccinated and having had the virus.
But if you are partially vaccinated or if you only have been previously infected, the data that I've seen suggests that your immunity will not be as good as if you are fully vaccinated.
McKean says another thing to keep in mind is that children under 5 are not able to get the vaccine, and the virus isn't going away anytime soon.
I think really what I think concerns me the most are all the high risk, all the vulnerable, and all the immunocompromised that are kind of hung out to dry a little bit here. And I think we're going to have a lot of disabled and suffering people from this, because as we know, death isn't the only outcome.
For Indiana News Desk, I'm Pat Bean.